Good day, viewers. My name is Mr. Kevano, and welcome to our first lesson for Life Science Grade 9. Today's topic will be infectious diseases. Today's learning objectives: learners should be able to list common infectious diseases in Namibia and discuss their social implications, such as malaria, TB, cholera, polio. Outline different ways of transmission of infectious diseases. Before we go any further, let me quickly explain exactly what an infectious disease is. Infectious diseases are caused by pathogenic microorganisms such as bacteria, viruses, parasites, or fungi. These diseases can be spread directly or indirectly from one person to another through contact, by inhaling mucus droplets, or through body fluids. Some of these organisms are transmitted by insects or other animals. Others may be ingested with contaminated food or water, or may be transmitted by organisms in the environment. There are many organisms living in and on our bodies. They are normally harmless or even helpful, but under certain conditions, some of these organisms may cause diseases. The first infectious disease in Namibia that we are going to look at is tuberculosis, or TB in short. TB is transmitted by bacteria that spreads through the air from one person to another in tiny droplets. TB bacteria usually grow on the lungs. The signs and symptoms of TB are coughing for 3 or more weeks, coughing up blood and chest pain, or pain when breathing or coughing. These are the most profound symptoms, but of course, there are other symptoms which are not unique to TB that one can also experience. Note that you can experience the symptoms of TB in other parts of the body, depending on the area affected or infected. To prevent TB, a person having TB should stay at home, eat healthy food, and get plenty of rest. Staying in a well-ventilated, clean environment with good light is important. He or she should cover the mouth and nose when coughing and sneezing, and take the prescribed medicine when infected. Vaccination does not always protect people from TB. The next disease we will look at is cholera. Cholera is a diarrhea illness caused by an infection of the intestines. Signs and symptoms of cholera: severe watery diarrhea with vomiting, can quickly lead to dehydration. Transmission of cholera: eating food or drinking water contaminated by the feces of a person with Vibrio cholerae bacteria. Bacteria release a toxin in the intestines. It is most common in places with poor sanitation, crowding, war, and famine. Prevention of cholera: use only boiled water, at least boil for 3 minutes. Filter water by using a commercial chemical disinfectant. Use bottled water. Avoid raw and unwashed food. Wash food in clean water. There are still cholera outbreaks in Namibia from time to time, but it is usually stopped fast with quick and proper treatment. Even though polio has almost been eradicated in Namibia, we still need to learn about it since it is infectious. Let us look at the causes, symptoms, and treatment of polio. Signs and symptoms of polio: fever, fatigue, headaches, vomiting, stiffness in the neck, pain in the limbs, and paralysis of the legs, which is usually permanent. Transmission of polio. Polio is caused by a virus that enters the body through the mouth and then multiplies in the intestines. The virus invades the nervous system. The virus is shed by infected people, usually by children, through feces, and it spreads quickly. The virus is more prone in areas with poor hygiene and sanitation. Treatment for polio. Polio patients should get enough bed rest, take painkillers, use antispasmodic drugs to relax their muscles, use antibiotics for urinary tract infections, use portable ventilators to help with breathing, and in case where the virus has caused paralysis, wear corrective braces to help them with walking. Prevention of polio. Polio can be prevented by vaccinating children at the ages of 2 months, 4 months, 6 to 18 months, and 4 to 6 years. Apart from feeling sick and being sick, infectious diseases also have other implications for the sick person. Family and friends, in fear of the infected people passing the infection to them, may often reject the person suffering from infectious diseases. Infected people may lose their jobs and income when too sick to work, which may increase poverty in communities or in the country. If a woman is sick, the household activities can come to a standstill. When a person has an infectious disease, he or she can be discriminated against and even stigmatized. An outbreak of an infectious disease can quickly cause panic in a community or nation. In the next lesson, we will have a detailed look at malaria. Malaria is also an infectious disease. Let us summarize what we've learned about infectious diseases. Infectious diseases are caused by pathogenic microorganisms such as bacteria, viruses, parasites, or fungi. Infectious diseases can be transmitted from person to person through contact, by inhaling mucus droplets, or through body fluids. Infectious diseases can also be transmitted by insects or other animals, or by consuming contaminated food or water, or even by being exposed to organisms in the environment. Some infectious diseases are malaria, TB, cholera, and polio. People with infectious diseases are often discriminated against, and the poverty level in a community or country increases because people lose their jobs and income when they contract infectious diseases. Viewers, before I sign off, I would like to ask you a few questions to reflect on today's work and to test your understanding. 1. Explain the term infectious disease. 2. Name 3 infectious diseases that can still be found in Namibia. 3. What are the signs and symptoms of TB? That's all for today. Make sure you guys stay healthy. Take care until we meet again.